Are your symptoms of fibroids? So if you're interested in knowing, watch till the end of the video and let's see if the symptoms you experience are symptoms of fibroids. So what's the first thing I want you to know? Not everybody who has fibroids have symptoms. We call them asymptomatic, and thankfully about 50 to 80% of patients who have fibroids do not have symptoms. Now for the other to experience symptoms, these are some of the symptoms of fibroids: abnormal uterine bleeding, and this can be in the form of heavy menstrual bleeding. So you just notice that your periods are usually heavier than normal. You're using more sanitary towels. At times you even have to use two sanitary towels together. I've had a couple of patients saying that they actually have to use Pampers because their periods are that heavy. There's no how they would go out without their underpanties or their clothes getting soaked. If you notice that you have to change your pad almost every hour, every 2 hours, that's very significant. It means that your period is heavy. I think I've talked about heavy menstrual bleeding in the previous video. When we say heavy doesn't just mean the amount of blood, also the duration of your menstrual bleeding. So if you are bleeding for more than 7 days, it's also regarded as heavy menstrual bleeding. Another form of abnormal uterine bleeding is intermenstrual bleeding. It's not your period, but you're seeing blood. Others may actually see blood after having sex, and this would depend on where the fibroids are located. Obviously, if you have heavy menstrual bleeding, if your bleeding is so severe that it's beginning to affect your quality of life, you are becoming anemic, you require blood transfusion, definitely those fibroids have to be taken out, or your symptoms need a proper evaluation. Then we have abdominal swelling. Well, we've seen a couple of patients, or we've seen videos whereby people are greeting a woman, congratulations on your pregnancy, not knowing that she's pregnant with fibroids and not a baby. So for other patients, they notice that there's this swelling in the abdomen. It's initially small, and they notice that progressively over time their abdomen is getting bigger, their pants are getting tighter, their skirts are getting tighter, they can actually see a bulge in their abdomen. Yes, that is a symptom. And for patients who have abdominal swelling, other symptoms will now depend on which organs this uterus is applying pressure on. One of the common symptoms they may have is frequency of urination. So they notice that now they have to go to the toilet to pee more often, or they pee and they still have this feeling that they're still pressed but nothing is coming out. These are pressure symptoms due to compression of the bladder by the mass. Constipation, may have feeling of incomplete defecation. So you go and poo, but you still feel that there's something still left inside, and that's because the mass is also compressing on that part. Then for very, very, very big fibroids, you notice that you just always have this abdominal discomfort, you're feeling bloated, you eat small, you're already full, and that's because the mass is also compressing on your stomach. Others may complain of pain during sexual intercourse, and again, this also depends on where the fibroids are located. And so for the pain is definitely not a good thing. Pain is not anything any woman should just endure. No. And so you can have different types of pain. The period is usually not usually, but it depends on where the fibroids are located. So some may have severe painful periods. Others may have pain outside their periods. So they have lower abdominal pain, pelvic pain, back pain, and pain over a fibroid. So there are some that you can actually feel the fibroids, and then when you even touch it, it's actually very tender. A patient can actually say, this is where I'm actually having pain. These are the common symptoms of fibroids. There are other ones which may not really be called symptoms, could also be complications of fibroids, but these are the main symptoms of uterine fibroids. So if you have any of these symptoms, abnormal uterine bleeding, pain, whatever form of pain, pressure effects depending on where the mass is compressing, please, you need to see a doctor, you need to see your gynecologist, you need to get evaluated, and you definitely require treatment. Why are symptoms important? It's important so that one, you know when to seek for medical intervention, and two, if your fibroids are asymptomatic, meaning that they're not symptoms, there's really no need to treat.